present our French experience in the north of France with Gauchez, who is a physiotherapist and well known in the field of lung clearance. So our aim will focus on lung mechanics assessments of the technique using the force oscillation, and we'll talk about 3 case reports and then about an ongoing clinical trial. It's not easy in practice to evaluate objectively the performance of lung clearance techniques. So we can apply spirometry, which was shown to be very insensitive to short-term and long-term benefits of physiotherapy. You can use lung volumes, and then maybe Simeox has an impact on hyperinflation, but there are very few data to date now. And you can use lung clearance index, which is very sensitive, but with controversial results in physiotherapy, and its availability is very low. So we'll briefly discuss a new technique, at least in the commercial field, which is a force oscillation technique, which was produced by Dubois in the late 50s. The principle is very simple. You have a loudspeaker, which inputs the airways with low frequency to moderate frequency, about 30 Hz, and you record mouth pressure and flow during the session of 20 to 30 seconds stimulation. There are 2 parameters derived from the force oscillation technique, which is resistance, as you know, with PET seismography, and reactance with flow and pressure out of phase. We use different frequencies from 5 to 30 or 40 Hz, but the main difference between these frequencies is that low frequency pressure goes down to the alveoli, so it's a very wide assessment of the airways, whereas when you look at higher frequencies, you only focus on the proximal airways. So the difference between 5 and 20 Hz is the frequency dependence of oscillation, and it represents small airways' contribution to the increased resistance. You can use very simple devices, such as the TremoFlow device, which is a hand device, very simple to use to obtain these results. So when you look at the curves obtained with the FOT parameters, you have here in the upper part the resistance. You see that the resistance at 5 Hz in most airway disease is higher than 20 Hz, and the difference between the two is the contribution of small airways. When you look at the reactance on the negative part of the scheme here, you can see that the most interesting parameter is X5, which is somewhat derived from the small airways compliance. And also another index, which is the difference between inspiration and expiration, which is an index of flow limitation. So here, small airways, and here, central airways. We use this device to evaluate the impact of a single autogenic drainage session, and as you see on this graph, R5 and R11 decrease after a single session of physiotherapy using autogenic drainage, which is a classic technique in physiotherapy. 2 cases, adults, to discuss this kind of results. A very severe patient with a CF patient with FEV1 25% predicted, hospitalized for the severe exacerbation, and the session is done at day 7. You see that the gas are very critical in this patient. And we used 2 full cycles, and it was moderately tiring to the patient. We did not report any exchange in dyspnea, but it was very severe. When you look at the resistance pattern before and after, pre here in blue, dark blue, you see that there is a marked difference in the R5, less than 18%, a marked reduction of the difference between R5 and R20, which shows that the contribution of the small airways is decreasing, and there was a non-significant change in reactance, but at least a very significant effect on airway resistance, especially at low frequencies. A second patient, younger, but very severe in terms of airflow limitation, with FEV1 24% predicted, lung transplantation was considered in this patient. She was colonized with Achromobacter and also assessed in stable condition, but with a recent exacerbation history. She usually used ACBT as her preferred technique, and we use a single Simeox session with 2 full cycles, and she described a less timing session than with usual physiotherapy, which is an important point in these patients. As you see, the same pattern of improvement appears. That is a marked decrease in low frequency resistance, a marked decrease in the frequency dependence of resistance, less than 30% or above, and a moderate increase in R5, X5, which is in the terms of, in the sense of improvement. So that is the clinical data in adult patients, and Gauchez will tell the story of a younger patient.
Thank you. In our practice and physiotherapy, in our ambulatory rehabilitation center, we used to have a lot of patients, CF, adult. And these patients come from a lot different parts of the country. And for 1 week or 2 weeks, or sometimes during 1 month, for 5 hours per day of physiotherapy and 2 hours of sport. And for the first time, or for second time, we have a very little girl, 7 years old, with very severe disease, lung function and pulmonary function would decrease very earlier with an FEV1 at 30%. And she has benefits of rehabilitations for the first time 1 year ago, and she come back this year for 1 week. And ici c'est comment le truc voilà. For intensive rehabilitation. And for the first time, we introduce in our treatment Simeox. We use Simeox every day since 2 years ago now, and with a very good result. But it was the first time with a young girl. And she was very tired. She was very encumbrant, okay, with a very thick mucus, and physiotherapy was very difficult and need a lot of effort and fatigue and so on. And our unique objective during 1 day, every day, is to mobilize mucus with different techniques, like physical activity and mobilization and massage, relaxation, autogenic drainage, and very precious time for inhalotherapy, for very serious inhalotherapy, and stretching, incentive spirometry, and we have introduced Simeox during the session of autogenic drainage. It was very interesting for her because it was very relaxing, and she feel the sessions like a game, and it was like a funny moment, and it was very, very interesting for her, and it was new for us. And the result, after 1 week of that treatment, of a lot of sessions per day, it's to increase FEV1 from 36% to 50%. It was a very, very interesting result. And our physiotherapy has to be evaluated every time, and we have test and do evaluation with oscillometry. And it's a very easy test, and for the results we can give the results to our CF center and to the Dr. Pérez to evaluate our physiotherapy.
Thank you. So if we look at the results of the technique, which is very simple to use in this very young girl, the pattern is a bit different from the adult results previously. We see at baseline, first day of physiotherapy, a marked increase in resistance and a very low reactance. The scale just is not the same. But at day 3, we had a significant improvement in reactance, which suggests an improvement in the compliance of the small airways. The resistance didn't move. So quite a different pattern from the adults. Of course, we need much more data to obtain this confirm this kind of profile, but there was a marked improvement in reactance. I will now introduce our project of a clinical study to support the clinical efficiency of the device, which is called Simeox study, and which could start at the end of the year. The main outcomes of the subject is to evaluate the short-term effect on lung mechanics of the Simeox via comparator, which is autogenic drainage in adult and children above 12 years of age. So the main aim of the study is to evaluate the mechanics before and after Simeox by airway resistance, FOT, spirometry, plethysmography, and to see the respective impact of Simeox via autogenic drainage in these patients, and also clinical symptoms, which is dyspnea, encumbrance, and physiotherapy-induced fatigue, which is a critical point in these patients. And also evaluate the relationships between lung mechanics and clinical data. We will include patients with a FEV1 between 40 and 70% predicted, with, of course, significant cough and sputum and encumbrance, and some exclusion criteria, as usual in this kind of study, particularly pneumothorax or recent hemoptysis. The scheme of the study is as follows. You have a randomization on the crossover device, crossover design with Simeox or autogenic drainage session during 5 days, and then crossover with a washout of 48 hours. And at each session, we will record the FOT results before and after physiotherapy. And the main outcome is the difference between baseline at V1 and post-physiotherapy at V5 in both arms. Of course, we will compare the two sequences, Simeox vs autogenic drainage. So these are the outcomes. Primary outcome is R5 between the two, the beginning and the end of the session, of the 5 days sessions. Other FOT parameters, spirometry, plethysmography, plethysmographic resistance, volume, to see if we have an effect on hyperinflation, FOT pre-post each session, and of course, visual analysis case for critical symptoms in these patients. And we will also evaluate the correlation between all these parameters. The study should be started at the end of the year. Now, in conclusion, we can say that in our experience, in most CF patients, both adults and children, the device were well appreciated and gave the impression of some clinical improvement in the patient. It was feasible in the two described cases in severe patients hospitalized in acute exacerbations. Our preliminary data showed that should improve lung mechanics as assessed by forced oscillation techniques with a reduction of R5 or an improvement of X5. And it's, in our opinion, a promising technique which requires comparative clinical studies to support its efficiency. Thank you very much.